Welcome to the Clinical Examination Tutorial Series. My name is Dr. Benninger. I work here at Oregon Health and Science University. Today we'd like to talk about the cranial nerve examination. Generally this examination should take 5 minutes, often referred to as the modified cranial nerve examination. I'd like to start off by thanking our volunteer patient, future clinician, Dr. Hudak. All right, we'd like to start off with the olfactory nerve, the first nerve of the 12 cranial nerves. And with that, there's a sense of smell associated with that. And the first thing one likes to do is ask the patient to go ahead and close their nose and block off one nostril. You waft the scent underneath and ask them, what do you smell?
Coffee.
They smell coffee, and then you repeat that and ask them to then block off the other nostril, waft the scent underneath,
Coffee.
and ask them what it smells like, and indeed it was coffee on both occasions. And from that, you would then move on. However, if it was altered, if she happened to say one side was slightly different than the other, then you would come up with 3 classic questions. But before those, just be aware, why did we choose coffee? And one of the things in this world where people can travel so easily from one continent to another, or another part of something within the continent, you want to be aware that you need to use a universal smell. 2 classic universal smells are coffee and something citrus, generally orange or lemon. And most places, wherever you go in the world, people are familiar with coffee and something citrus. Now, if there was something altered in that, I would then follow it up with my first question next would be, are you a smoker or have you just recently stopped?
No.
Okay, and that's probably the commonest cause of altered sense of smell is someone who smokes. The next one would be, have you recently had a cough or a cold or sinusitis, any type of upper respiratory tract infection?
No.
Okay, and then lastly I would ask, has she been involved in any sort of trauma? Has she been involved in a motor car accident, fallen off a bicycle, skiing accident where she had a concussion or a head injury?
No.
Okay, those are probably the 3 most common questions you'd like to ask whenever you think sense of smell has been altered. We would then like to move on to the second cranial nerve, the optic. Now with that, you would look at the patient, and the first thing you start with is just to examine the eyes themselves from a symmetry point of view, and we look at the pupils. We want to see that the pupils are equal. Majority of the population have equal pupils. However, there are some people within the population who have unequal pupils, and that's still within normal range. And that's terribly important because imagine if someone did have some trauma, they've come into an emergency room situation, and someone looks and says they've got unequal pupils, and suddenly scans and various things are organized when it may have not been appropriate. So it's very important that that documentation stay with one's patient. First thing I'd like to do is just let them know that I'm looking at both pupils, and most pen torches that we use today will have some sort of grading system on the size of pupil. It's probably not as important as to say that they're either equal or they're not equal, and saying that the right is either smaller than the left. Okay, but a lot of these will have a grading system on them, a size 4, size 5, etc. The next thing is I'd like to say that we're going to shine a light in your pupils to see how they react, and that's very important that you get a pupils and how equal and reactive they are to light. Now, this technique can often be a little bit aggressive for the patient. In other words, sometimes beginning technicians or examiners will come in directly from the front with the bright light. And remember that whenever we turn on these pen torches or lights here, there is a peripheral, very softer light, and then there's a central, very bright light, much more acute. And so what we don't want to do is come in very aggressively. It's a bit off-putting, and it just doesn't set a good scene for the rest of the examination. So what one wants to do is just come in from the side and tell them to look straight ahead. And I like to just start and just show them just briefly the very soft light, and I watch the ipsilateral or the same side pupil and see how reactive it is, and I do that twice. The second time, I do it on the same side here, but I'm actually looking at the opposite pupil, the contralateral pupil. Once I do that, I then switch hands, and I come in from the side, and I do the same thing twice. Once looking at this side and watching the pupil and observe that. Once on the opposite side, i.e. the ipsilateral and contralateral sides. Once that's been done, you would record that, and then you move on to the second portion of that same cranial nerve number 2, and you're going to check for the red light reflex. I generally like to get a hand's breadth apart, and you then use the same eye. So if it's the patient's left eye, you would then hook up the the ophthalmoscope to one's left eye, have a look, make sure you can locate that red light reflex, and then let the patient know that you're going to be examining them and you will come in very close quarters with them and tell them not to be concerned about that. When one comes in, they get in very close here, and what you're looking for is the disc. You're looking at the vasculature or the vessels, making sure that they all look terribly healthy, that you don't see copper wiring or cotton wool spots, indicative of perhaps hypertension, and various other things. You want to have a close look at that. Now, from there, you can do visual acuity. Generally, you would use a Snellen chart, but when you're doing a modified cranial nerve examination, and you're in your office or someplace like that, emergency room, you find something that's relatively about 18 feet away, and you could ask them to say, could you please read what's on that poster there?
Sky Eye Camera.
Right, and you read that and you want to double check and make sure, do you normally wear contacts or glasses? If so, have them wear their glasses or contacts while they're reading, document that, and you would move on. From that point, you would then go to peripheral vision. And now with peripheral vision, you've got to be a little bit cautious about that. People tend to be relatively competitive when you ask them to assess themselves. Now with that, I like to look straight on with the patient. And from that, I would say you test the upper and the lower zones on both sides. Now what I'd like to do is, the classic problem is if you say, let me know when you see my arm moving, the moment I would move, the patient, if they're really competitive, would say, I can see that right now. I can tell that's in my peripheral vision. What I like to do is move my arm, but also then say, don't say that you can see myself until you see my fingers moving. And so these are my fingers moving. This is just my arm moving, okay? So I usually like to, for the first time, just move my hand or my arm without my fingers moving, just to see if they're truly paying attention. So you ask them to look straight ahead, not look at your arms or your hands. Start out here as far and back as you can go, so that you're out of their peripheral vision, and then start to bring it in. Okay, yes. And she's recorded that she can then see it. I've assessed that. I go down to the lower area. I then come in.
Yes.
Okay, and you would do that on the opposite side as well. And that's just assessing that peripheral vision. And again, be cautious how you do it, because people want to be terribly competitive. The last thing I do is accommodation. And generally what happens is one takes their finger out here, again about a hand's breadth apart, and you come in directly right down at their nose. And I always save that for the last, because some people are so sensitive that you do that, it can trigger off a type of nausea, or even in some people perhaps they may actually get sick. To do that at the start, I think, would be very antisocial, and it's best to do that at the end of that eye part of the examination, so that then you move on to the next portion. Okay?